I take great pride in introducing to you a patient and someone who's fast become a dear friend of the Parkinson's Institute. His name is Bill Schaefer. He will be our MC today. Every time I email Bill or call Bill and say, could you, he says, sure, when do you need it by? And I'll say, could you do it by? And he says, would an hour be too soon? So I've figured out what he does with his time, but he's always Johnny on the spot, and I'm very grateful to him and for him. So without further ado, allow me to introduce Bill Schaefer, and I will turn the microphone over to him, and he will run the rest of the workshop. Bill.
Having a microphone in my hand is could be a dangerous weapon. Let me see what I can do over here without it. Yeah, Mary is quite correct. The first time I came into this building, I left being a patient. And then the second time, I left being a patient advocate. I said to my wife, finally somebody's recognized my true value. I'm going to be a lawyer on behalf of patients. That's what an advocate does. But I discovered that after being an advocate, the next step is MC. I'm not sure whether that's going up or going down. Very hearty welcome to everybody. The subject of this series of panelists that you're going to be listening to today and hopefully questioning is managing everyday PD in everyday life. And you know, we can't cure it yet, but we sure as heck can manage it. At least that's what I try to do, and I hope that you'll do the same. Okay, so we're going to start with a woman who's a speech and language pathologist for the Parkinson's Institute, Randy Hoffman. She provides the speech therapy, and she works with something called the Lee Silverman Voice Treatment Program. Has anybody heard of this? Would you recommend it?
Yeah.
Thanks, because I need it. This program is the most effective for PD patients who have swallowing or speech problems or both. Here's the family connection here. She has a degree in speech and hearing science from the University of Illinois and a master's in speech and language pathology from the University of Tennessee. And the University of Tennessee happens to be where my beautiful, intelligent, talented daughter-in-law comes from. So Randy, if you're ready, come up here, and Randy's going to talk for about 10 or 15 minutes. We're going to then open it for questions about speech pathology.
All right. Thank you very much.
You're welcome.
All right. Good afternoon. My name is Randy Hoffman, and I help people with Parkinson's or PD to improve their speech and voices. I'm going to read you a quote. If I have no voice, I have no life. And this is a direct quote from an individual with Parkinson's. It shows that the devastating impact that a speech and voice disorder can have on the quality of someone's life. 89% of all individuals with Parkinson's will experience change in voice and speech. All of you have a packet, and I want you to turn to the page in your packet that starts with, people often ask me to repeat a statement. I think that's the second to the last page in your packets. It's a questionnaire. So the first question is, people often ask me to repeat a statement. Does everyone have it? All right, so as I start to talk, I want you to listen, but I also want you to kind of peruse this questionnaire because it raises some of the issues that people with Parkinson's have to deal with related to speech and voice. So 89% of all individuals with Parkinson's will develop speech and voice problems. And those problems can be a softer voice, can be a change in the quality of your voice can become more hoarse sounding, your speech can become more slurred or imprecise articulation. Sometimes the rate of your speech can change, it can become faster or it can become slower. And in some cases, some people with PD can develop stuttering, called palalia. Not everything happens in all patients, but a lot of these symptoms occur in people with Parkinson's. The good thing about these problems in there is a type of speech therapy tailored to Parkinson's that can improve all of these issues. And that's called the Lee Silverman Voice Treatment Program, or LSVT. LSVT, or the Lee Silverman Voice Treatment Program, is the most effective treatment for any of the speech and voice problems in people with Parkinson's. The research on this program was done at the National Institute of Health and the Department of Education. The key target of the treatment focuses on loud. And with loud, in order to get loud, you have to use increased effort. And that increased effort seems to have a neurological effect on people with Parkinson's, so your lips and your tongue and your breathing end up working in an improved way. And then you get a louder voice and a more clear voice. The way the therapy works is someone is evaluated to determine if they would be an appropriate candidate for the therapy. And if that person is deemed appropriate, it's a very intensive program. And it focuses on this concept of loud. Someone has to be able to come 4 times a week for 4 weeks. They have homework each night, and all of it is focused on getting a louder voice and better breath control. Many patients also have swallowing problems. 89% of the people with Parkinson's will develop a swallowing problem. That LSVT therapy targets the same muscles for speech that are also used for swallowing. So the same muscles that you use for speech are also used for swallowing. So LSVT not only helps your speech, but it also helps swallowing. There's a lot of data supporting this. I have seen hundreds of patients using this treatment program and have improved their voices and their swallowing. Early intervention is key. It's key to maintaining and improving communication. So if somebody has a speech problem, the sooner they get a baseline evaluation, the better. Many times when people have speech and voice problems, they stop communicating. They are not going to parties, they're not using the phone, they're letting other people talk for them. And that's the worst thing that someone with Parkinson's can do, to stop using your voice. We're going to do this questionnaire now. Let's look at it. The first question on top is, people often ask me to repeat a statement. Does anybody here experience people asking them to repeat? Okay, so what do you do when someone says, excuse me, or what?
Take a deep breath and talk louder.
Okay, how about the next one? People look slightly confused, or if they are trying hard to listen to me when I speak. Does anyone get that kind of response? People give you a quizzical look when you say something. Lyle, okay. So what do you do, Lyle?
Talk louder.
Talk louder, okay. My care partner comments that sometimes I slur or mumble my words. Does anybody here slur or mumble their words? No one. Oh, okay. My care partner comments that I do not speak loud enough. Anyone's husband or wife ever say, I can't hear you? All right?
All the time.
I feel that my care partner is ignoring me or may need a hearing aid. Has anyone, okay, so you know you say that, your care partner needs a hearing aid. I hear this all the time. It's not my voice, it's my husband or wife that needs a hearing aid. I do not attend social functions as often as in the past because I feel like people do not listen to what I have to say. Does anyone feel like they are not going into restaurants or going to parties the way they used to?
I go, but I just know I'm not going to do much of the talking. Everybody else is going to do the talking.
So you're kind of taking a background role when you go to different social events.
Especially restaurants.
Okay. I notice that I often give up when trying to communicate in a group or that others seem to talk over me. Anybody have that feeling when they get together with their families, that they're kind of sitting on the outside and everybody else is actively involved in the conversation? It's kind of a frustrating feeling, isn't it? No, you don't mind it?
No. I'm a quiet person to begin with.
All right. I feel like people do not think I have anything interesting to say. Does anyone have that feeling? Your husband? Okay. I avoid speaking on the phone when possible. Does anyone feel like they're having increased difficulty being understood on the telephone? I often feel a need to clear my throat.
Yeah.
Okay, so do you know why that is?
No.
All right. Before you had Parkinson's, your body would swallow thousands of times a day, and you never thought about it. It was all on automatic. You would swallow thousands of times a day during the day and at night. It was automatic. Now your body is not automatically swallowing that saliva as frequently. So what's happening is you feel saliva in your throat, and you feel that need to clear your throat to get rid of it. Clearing your throat is the worst thing you can do for the muscles in your throat. If you look into your handouts, there is a picture of two heads, kind of like this. And in the diagram on the left, there is somebody who has two skinny muscles in their throat. Those muscles are your laryngeal muscles. They make up your voice box. Before you had Parkinson's, those muscles would vibrate and come together all the way. With the Parkinson's, there is more weakness in those laryngeal muscles. So they're bowed in many patients. They're not coming together. So when you clear your throat a lot, you're banging those little skinny muscles in your throat together. And if you do it enough, you end up irritating your throat. Instead of doing that, when you feel something sitting in your throat, just try doing a dry swallow. Go ahead and swallow. Can you do that? That's a much more effective way to deal with that feeling of the tickling in your throat. Or to drink some water. Another thing that happens in people who have Parkinson's is a lot of times, because they're not drinking water as frequently as they should, their saliva becomes thicker. So the worst thing you can do is not drink water, because you need to keep that saliva thin enough that it's easier to swallow. All right, so there was one other comment on that questionnaire. When finishing a conversation, I feel frustrated at being unable to communicate what I had to say. How many people here, when they go into a restaurant, have somebody else order for them? Anybody? Well, that's good, because everybody should be ordering for themselves. Everybody should be going to the delicatessen and ordering for themselves. And a family member is not helping you if they take over that job. All right. Let's talk a little bit about what you can do in your daily lives to improve your voice. If any of those questions or any of those issues on that survey were things that you felt you're experiencing, I suggest you get an evaluation by a speech therapist, and not just any speech therapist. You want to be evaluated by a speech therapist who specializes in working with people with Parkinson's. The people who specialize in working with people with Parkinson's are LSVT certified. That means they've chosen to specialize in helping people with Parkinson's. A regular speech therapist does not have that kind of training. So if you're going to get an evaluation, make sure that person is LSVT certified. In terms of what you can do besides the evaluation, let's talk about some things that you can do right now. I want everyone to sit up in their chairs, get your spine long, and I want you to do what I do. Take a deep breath, and I want you to say, ah, and hold it as long as you can. Here we go. Great. Great. So, when you do that particular exercise, that forces those muscles, those laryngeal muscles in your throat, to come together more. It's like push-ups for the muscles in your throat. It's a great exercise to do. And it starts with a low, deep breath. Let's do it again. when you do the exercise, it's very important to make sure that you really open up your mouth, really use all the muscles in your face. The Parkinson's wants to make everything small and tight. Wants to make your mouth not open as much, wants to make your tongue and your lips not do as much. So when you do these ahs, you want to think loud and big. Let's try something else. I want you to take a deep breath, and I want you to count to 5. And I want each number to be loud. So take a breath. 1, 2, 3, 4, 5. Good. Did you feel like you were yelling? Okay. Parkinson's is not just a motor problem, it's a sensory problem too. Can everyone hear me? Yeah. Okay, good. So you feel, when you are whispering like this, that this is loud enough because your brain, because of the Parkinson's, is telling you that the quiet voice is normal. But that quiet voice is not normal. You've become accustomed to using that soft, hoarser voice. When you get louder and closer to a normal sounding voice, it feels like yelling to you, but it's not. So the challenge with working with somebody with Parkinson's is not only to make their muscles stronger so they can get a louder voice, but also to kind of recalibrate their thinking about what a normal sounding voice is. And that's why sometimes it is hard for somebody with Parkinson's to get back to that normal voice. So it's a matter of strengthening the muscles and changing your thinking about what it takes to get to a normal voice. Let's try something else. I want you to take a deep breath and say what I say. Good afternoon.
Good afternoon.
Take a breath. Good to see you.
Good to see you.
Again, thanks for calling.
Thanks for calling.
I'd love to come.
I'd love to come.
Okay, so as you do that, you're really pushing your muscles. You're pushing your diaphragm. You're pushing these laryngeal muscles. Everything is working in a very loud, large way. And that's what you need to do with the Parkinson's. So in your everyday lives, how can you incorporate some of these things into your voices? Well, for one thing, when you're sitting next to somebody in the car or you're driving, as you see the signs on the highway, you can read them aloud. You can say, okay, El Monte, Page Mill Road, but in a loud voice. You can decide, okay, when you're reading the newspaper in the morning, that you are going to read the Macy's ad out loud. Or you can take a paragraph from the sports page and find out what happened with the 49ers, but read it out loud. The more you can use your voice and push it loud, the stronger those muscles will get. But there's a good way to do it, and there's a bad way to do it. So I think if you are noticing changes in your voice, you need to get an evaluation, but meanwhile, you need to start using your voice. And I think those ahs are a good thing, and I think reading aloud is a really good thing. If you have poetry books, you could take a poem and read that aloud. If you have grandchildren, you could take a book out and read a poem aloud to a grandchild or a short story to them. But you need to use your voice, and reading aloud is one of the best things you can do for your voice. All right, so can I answer some questions for people? Yes?
You mentioned not to clear your throat because it puts those little laryngeal muscles together.
It bangs them.
So the difference between that and speaking is that it's not banging because you said it gets them closer to.
You want a normal voice. In a normal voice, normal speech happens when you take a breath. Your diaphragm pushes the air up into your lungs, and then that air comes up and it vibrates those muscles. If those muscles are weak, if they have a tremor or they're bowed, they're not coming together all the way. So you are getting a softer, hoarser voice. Ideally, when you strengthen those muscles, you're getting them to come together so they are vibrating like this, and it's kind of a gentle vibration. When you clear your throat, it's not that gentle vibration. It's like bang, bang, and it gets those muscles inflamed. So double swallows are much better when you feel like something is tickling in your throat, or get a sip of water. Yes?
Sinus problems.
Yes?
When you have a post-nasal drip coming down all the time, how do you handle
The dripping. Have you talked to your doctor about that?
He gave up.
He gave up? Sometimes I think they sometimes, a doctor will frequently recommend something to dry you up a little bit,
Oh, yeah, he's giving me stuff.
like Mucinex or something like that, but do you see an allergist?
An allergist?
Yeah.
Yeah, I've been through the allergy group down here. Whatever street it is, where they draw the lines on your back.
Mm-hmm.
I'm not allergic to anything.
Okay. All I can say is if you have a lot of dripping, if you're feeling that there's a lot, I would try to drink a lot of water and swallow a lot and use that extra swallow as much as possible. Because with that kind of a problem, it'd be very easy to clear your throat all the time to the point where your throat feels sore all the time. And that makes it harder to speak. If your throat is not adequately lubricated, it is harder to get to a good voice. If your throat feels dry or constantly filled with saliva, it is hard to get a good voice. So you're going to need to do that extra swallow or drink water, probably more than maybe some other people. Some people have the opposite problem. From their medications, they feel like their throats are dry all the time. So they need to really make sure they drink water, or when they're not talking, suck on a lozenge or chew some gum. Yes?
Could you review the time constraints or the time demands for the Lee Silverman program?
So the way it works is first you get an evaluation, and then you have to be able to come 4 times a week for a month.
How long would each visit be?
Each visit is about 50 minutes, 50. So it's, and you're tired after each session, you are exhausted because it's like going to see a tough personal trainer. But I'm training, or any LSVT therapist is training the muscles used for speech.
Can you tell us the cost of that?
If you have Medicare B covers the cost of the program. If you do not have Medicare, you should probably check with your insurance to find out what percentage they would cover of the therapy sessions. But even if you had to pay out of pocket, if it's worth it, if someone is starting to lose their voice.
And how much is it?
I think it varies from facility to facility. I can't tell you what they charge here. You'd have to, I don't know exactly. So you could call the billing person and tell her and ask her about it. But it's worth it no matter what the cost is, because once somebody has difficulty communicating, it's very frustrating, and it does make a huge impact on the quality of your life. If you cannot have a conversation, go to bridge and bid with your friends, or go get together with your book club and be understood, or go to a family meal and be part of the conversation.
Now, where did you say we could get this evaluation?
You need to see an LSVT speech therapist. So I do it here at the Parkinson's Institute, but if you go online to lsvt.org, it lists LSVT therapists by location. So you can click on like the state of California, and it will list the LSVT certified therapists in different towns and cities.
Why did you not recommend loud singing?
See, I think singing is great. I have a choir here. I think singing is good. That's why I have a choir. But singing is a little different from speaking. In some ways, it's similar because you take a breath and you use the same muscles. But when we speak, we don't have that same ongoing melody. It's a little different. It's a little different. But both are good. But the voice therapy is different from the choral singing. There's something different that happens when you talk, because when you are singing, you're not only thinking about loud, you're thinking about the tune, you're thinking about the words. It's different. When you are talking, you are focusing on, when you see me, on loudness. And when you focus on loudness, you get a better quality of voice, and then your lips and your tongue work better too, with the increased effort towards loud. But I think singing is great too.
You said something about to push your voice normally. Did you say something like push? You want to speak out loud. Push your voice.
When you have Parkinson's, you have to take a deep breath and you have to push. You have to use more physical effort to get closer to a normal voice.
Okay.
It's a lot more effort. frequently, partners, other people who don't have Parkinson's don't realize how hard it is for somebody with Parkinson's to get their voices loud. There's a therapist in Texas who does this drill. She makes the husbands and wives of the people with Parkinson's go around yelling for 15 minutes just to show them how hard it is to push your voice loud. But that's why you get training and you learn how to do it the right way with an LSVT therapist.
Om chanting, I imagine that's good.
Om chanting? Oh yeah, I think that's great. But again, that's not, I mean, it works on getting better breath control. You can get loudness, but you don't talk in an ohm. But ohming is similar to ahing. So when we did those ahs, it's similar. But I think the ohming is good, and I think yoga is good too. But I think if you are having problems with your voice, I think you should get someone to work with you on it. But I think stick with the ohming, because that can only help too.
One of the things a lot of my patients ask me, they say they have a lot of mucus in their throat, particularly in the morning. And I usually recommend something like pineapple juice for that, but I was wondering if you have any other recommendations.
Pineapple juice, that's interesting.
It mostly has enzymes in it, if it's fresh or frozen, that break up the mucus.
I think water or something hot would be a good way to break up the mucus, whether it's tea or coffee or hot water with lemon or honey in it, something like that. I think hot is good.
Okay, thanks.
Thank you, Randy,
You're
very,
welcome.
very much.